ಸ್ಟಾರ್ಟ್ ಆಯ್ತು ಮೇಡಮ್ ರೆಕಾರ್ಡಿಂಗ್.
ವೆಬಿನಾರ್ ಮೇಡಮ್ ಇದನ್ನ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ ಮೇಡಮ್ ಪ್ಲೀಸ್.
Okay. Namaste everyone. Hope I am audible and my internet is stable. So it's a wonderful evening today because it's World Cancer Day and we have a wonderful guru with us who wants to share his expertise and his experiences in this field. What to ask more from Lord Dhanvantri, isn't it? Because our organization RAAUOS is dedicated towards diagnosis, management, and prevention of cancer. And on this Cancer Day, we have a webinar happening on management of cancer. We have to consider this as his blessings indeed. For whatever selfless work we are doing, this is a signal from Lord Dhanvantri that you can do more. So, with that thought, I request all of you to join hands with our organization to do this noble cause. With this, I welcome all of you for this 55th webinar on the topic Clinical Experience in the Management of Cancer through Ayurveda by VAIDYA TAPAN KUMAR sir. Before we start, I would like to invite Dr. Shubhamangala Acharya Madam to render prayer.
Thank you, Dr. Rachana. It's my honor to be doing the prayer for today's session. You can hear me, right?
Yes, doctor.
Thank you. Agajanana Padmarkam Gajanana Mahadisham Anekadantam Bhaktanam Ekadantamupasmaye Ekadantamupasmaye. Om Namo Bhagavate Vasudevaya Dhanvantaraye Amritakalashahastaya Sarvamaya Vinashanaya Trailokyanataya Shri Mahavishnave Namaha Shri Mahavishnave Namaha. Thank you.
Thank you, ma'am. With blessings of Ganapati and also Lord Dhanvantri, we'll move forward with our session. We know in cancer, time matters more than fear. Because as soon as people get diagnosed, cancer kills them next. But the fear of having cancer kills them first. So with that background, RAAUOS organization was formed just to see that people have a better life. Even with diagnosis of cancer, we want to give quality life to patients who are diagnosed with cancer. So this organization was founded by Dr. Shakuntala Patil Madam. Many might know how our organization works, but still I would like to invite Dr. Shakuntala Patil Madam to introduce our organization to the gathering.
Thank you, Dr. Rachana Madam. Namaste Tapan sir. Really, we are blessed to have you on the occasion of World Cancer Day. I feel it is a blessings from Dhanvantri only, because today you came and you have taken your time to share your knowledge. Because it's a to tell it is a share your knowledge is a very mean word what I say, because you have vast experience in the field of cancer management, more than 5 decades. Thank you so much, sir, for joining our call. today you have taken time, and it's our blessings that we have met you on the month of February last year. Thank you so much, sir. And I welcome all the delegates for today's wonderful and special webinar. And to tell about our RAAUOS team, RAAUOS is Rudra Arbuda, Ayurveda approach under one shelter. As name suggests, it is the intention, having the intention to bring in the one chain system all the Ayurvedic oncologists to share their knowledge, to connect each other, to connect with the Ayurveda Vaidyas, where through we can connect local public, and there we can say about organization, and we can tell actually honestly and fearlessly that we can able to treat cancer in the cancer through Ayurveda, because many public don't know about this. With this intention we have started with got Dhanvantri blessings. With along with that, it is a 55th webinar. It's in 2019 and November 21st we have started this organization. After that, many works have taken up. One is webinar, and second one is we are conducting 5 classes. One in the morning, Samhita Parayana by Vijayalakshmi Madam. Since more than nearly 2 years, Madam is taking Samhita Parayana. And second is on Monday, one class is yoga class is going on. We are taking Rasatantra Sara Siddha Prayoga Sangraha for the reference. And team is Dr. Savitri, Dr. Rachna Madam, and Dr. Akshay Tandle for this actually. And second is on Thursday, we are conducting especially on cancer. Now breast cancer is going on. That previously one time always we have already done breast cancer in the cancer classes. But this time we are inviting expertise for this to share their knowledge. It is doing on Thursday for 1 hour, 1.5 hours we usually do for these 2 classes. One more classes we have taken up 2 months back. That is a research and documentation. And even that along with that case paper, how to make case paper of cancer case paper especially. Almost it is one common cancer case paper ready by the effect of Dr. Sudeep sir, Dr. Beena madam, and Dr. Aditya and Archana madam, Shubhamangala madam. All of them are involved in the case paper, and even Sejal and Dr. Chauvi and Dr. Rachana has given their wonderful part of that to make the case paper. Thank you so much. And tomorrow, day after tomorrow, we are announcing RAAUOS case paper, cancer case paper. And another one class is going on. If any Vaidyas wants to treat their cases in their premises with the expertise advice, we are arranging a class for them. So we have arranged very less class because less request has came. Apart from they are giving the request personally rather than in the group sometimes. So that is also going on. We are preparing our own medicines. More than 35 medicines have prepared from RAAUOS Rasashalas, and we are conducting educational tour, that is Ayurveda Yatra. In that Ayurveda Yatra, we met Tapan sir in the month of November. We have done Gujarat, we have done that. And we are conducting this screening camp and public awareness camp in the local language. We have started offline and online both. Now the team has extended to Andhra Pradesh. Dr. Rajalakshmi Kaveti madam has taken that initiation to lead Andhra Pradesh and Telangana state. So we are inviting one by one for that. And along with that, cancer screening and awareness program this month and January month, almost 4 conducted. Today, Dr. Archana madam has conducted an offline awareness program, one of the this IT company. And apart from that, we are conducting we are supporting each other. That is the main point. That's why we call RAAUOS team as a RAAUOS family. So with this support, many of them has built their hospitals. Many of us are doing together medicines. Many of us are actually confident to do so many works in the field of Ayurveda. With these notes, I hand over the session to Dr. Archana madam. Thank you once again. Welcome all the delegates once again to this wonderful webinar.
Thank you very much, madam. There is a saying, amantram aksharam nasti, nasti moolam anaushadam. We know the meaning. There is no akshara which cannot become mantra, and no moola which cannot become aushada. But we have to know the second part of that shloka also. Ayogya purusho nasti. In our group, we say that every single member of our organization is unique and they are capable of doing so many things. That is what our organization believes. But the last part is the beautiful thing in this. Yojakas tatra durlabha. All these are okay, but yojakas are durlabha in this universe now. But we are very proud that we have a yojaka with us. That is our founder, Dr. Shakuntala Patil madam, who gives equal opportunity to every one of us. And also, she is tirelessly and selflessly working towards cancer eradication, maybe in the form of awareness, maybe in the form of treatment, maybe in the form of preparing case sheets, or how to. Every single day, she is living our organization. So we are very proud of you, ma'am, and thank you for introducing our organization to the delegates. Now I invite Dr. Nayana madam to introduce today's guest to the gathering.
Thank you, Archana ma'am. Namaste, everyone. It's my honor to introduce our speaker today. Though Vaidya Tapan Kumar sir need no introduction, yet it is a joy to highlight his journey that has inspired many in the Ayurvedic community. He is an humble humanologist from Ayurveda practicing family. Being a fourth generation of over a century old tradition of Vaidyas, he humbly holds a capacity of 25 plus years experience of practicing Rudrok Chikitsa since 1987 till date. Vaidya Tapan Kumar sir is the humble devotee at the feet of his beloved Sadguru Anantananda since 1991 till date. He is trying to uplift his spirit by the media of Sadguru Seva. He, after completing his professional post-graduation in Ayurveda, has started the training of Ayurveda at the feet of Sadguru in 1991. During these 25 plus year, he had learnt a lot, resolved the ego a lot, and enjoyed the bliss of assisting the Sadguru. Sadguru Ma also have bestowed her unfathomable blessings on him during his journey as chief assistant. He and his Sadguru have witnessed and treated more than 41,000 patients of various cancer in with Ayurvedic protocols. He, during his past tenure, have nurtured a wonderful authenticity on Nadi Pariksha, dealing with all casualties in Ayurveda and successfully helped the patients. His innovation in designing Panchakarma protocol for cancer patients are getting enthusiastic results and popularity. He has gained enormous popularity in the field of Ayurveda in India and also abroad. All this has happened only because of Sadguru Krupa, he adds. During recent decade, he with his wonderful team of eminent and veteran Vaidyas have created havoc at SGVP campus by continually rendering clinic services to SGVP Gurukul at Menmagar. He and his team have successfully conducted Maharan Yatra in 2011, Sadguru Sadguru Vandana Mahotsava 2014 and Shirodhara Carnival 2016. A Guinness World Record. Inspired by His Holiness Madhav Priyada Swami, now he has started his best services of 30 plus years of experience to SGVP Holistic Hospital since its insertion 2017. It is a 150 plus bed hospital with top class corporate healthcare of Ayurveda and yoga all together with a friendly team of modern doctors team and facilities. His dedication to the field of Ayurveda, Nadi Pariksha, research and academics will get better polished here at SGVP Holistic Hospital. With great respect and enthusiasm, I invite our speaker to share their wisdom with us. Over to you, sir. Thank you.
Hello, everybody. This is Vaidya Tapan Kumar.
Yes, sir, you can start.
Yeah. Okay. Fine.
Sir, 1 minute.
Thank you.
Just a second. Sir, Surendra Sharma, sir, are you there, sir? Sir told sir is going to.
Sharma.
Yes, sir. That day
Yes,
I
sir, he
told him.
was here.
He is there.
Oh,
Researched.
सर
Sir,
आप आए और ये सब ना आए तो नहीं होगा सर.
कल बोले ज्वाइन होते हैं. So just, sir, are you there?
नमस्कार जी.
नमस्ते नमस्ते प्रणाम.
नमस्कार सर.
नमस्ते. Is it?
Yes, sir. उस दिन
Should
मैंने
I?
आप बताया ना सर, सुरेंद्र शर्मा सर के गाइडेंस से हम लोग रसशाला बना रहे हैं और उनके गाइडेंस से बहुत सारे काम हमारे इसमें हो रहे हैं सर.
वाह, बहुत अच्छे, बहुत अच्छे. Hello everybody across the country. I am VAIDYA TAPAN KUMAR from Ahmedabad, Gujarat, India. A very good cool weather greetings to all of my dear listeners, Vaidyas, Rasasiddhas, students, research scholars, and my seniors. So, is necessary to talk in English only? और हिंदी भी चलेगा?
सर हिंदी भी चलेगा, इंग्लिश और हिंदी
वो
दोनों.
वो ठीक है चुप. देखिए, as far as cancer treatment is concerned, management is always of the patient. The treatment is of the disease. So we will take both together. In fact, when we are talking about cancer, there are, I want to postulate a new thinking for that. You see, we have a very good description of Sroto Dushti Lakshana. That is Ati Pravrutti, Sangha, Siragranthi, and Vimargranthi. But today I want to postulate that these four are the ways and means to treat each other. If there is an Ati Pravrutti in any disease, any Srotas, we have to do Sangha. If there is a Sangha in any Srotas, we need to do Pravrutti or Ati Pravrutti. In the same way, when it comes to Siragranthi, that is Samprapti, where it has got Grathan, compactness, and that is obstructing the normalcy of a particular Srotas or an organ or an Ashaya or Kala, then there is another opposite protocol that we can execute, that is Vimargaman, having a diversification. Just this happens in the outside also, when road are rushing like heavy traffic, then there is a Sangha traffic signal there. It blocks the heavy traffic. The remaining roads are open. So in that way, we can manage the Ati Pravrutti. And when there is an Siragranthi, some road block, then immediately we have to design a diversion from where the traffic can move further, and then we can treat the, isolate the block and treat accordingly. So these are Srotasam Dushti Lakshanani, but can be utilized as a Srotasam Chikitsa Sutrani also. So this is the, as far as these four are concerned, Sira Granthi are today's topic. The Sira and Granthi, both, or Siraj Granthi, they, when they produce some Grathan, and that Grathan is very hard and deep-seated and multi-organ spread, then we have to take the Vimargaman message protocol. This is just a new postulation. As far as my decades together clinical experience while treating cancer patients is concerned, I can share that the patients approaching to our institute, where I am heading and assisting my Sadguru, she is the sole source of inspiration, Ma Anandananda Tirth. She is a sannyasini and 80 plus years old physician from Ayurveda, traditional Ayurveda. And she has been engaged in treating the cancer patients since 1978. And I am working with her since 1991. When I joined her, the total number of patients were 9,000 plus. And just last week, when I finished my OPD, our OPD, the last patient that we saw was 41,334. So, such a huge database is lying with our organization. And when somebody asks me, how do you, yes, somebody raises hand.
Dr. Srilata, is there any issue?
They are clapping, sir.
Clappy. Oh,
Such
sorry.
different
Otherwise,
emojis.
okay. So the people who are approaching us for their treatments, or they are initially they are all diagnosed, biopsy diagnosed treatment patients of cancer. Among these diagnosed cancer patients, one group directly approaches us as soon as the biopsy report comes positive. They immediately approach us because they have been treated since their childhood with Ayurvedic treatments under the guidance of Ma Anantanand. And so they are well versed and very much assured about the result. So there is a group who directly approaches us. To them, the basic fundamental assessment gives us an impression that people are extremely ruksha. You understand ruksha? They're dried out because the cancer cells drag 2.5 nutrition than the normal cells. So the normal cells are all asnigdha, asantarpan, or apatarpit. So in that case, we immediately switch them on Vardhaman Kram of Grutpan, just as we do it before Panchakarma. We start Kanchanar Grut, Kanchanar Siddha Grut in Vardhaman Kram, say 10 grams, 20 grams, 30 grams, 40 grams, 50 grams, 40 grams, 30 grams, 20 grams, 10 grams. That way, some 7, 8, 9 days are given of Kanchana Guru Teja Shamana Sneha. This, in a week time, produces enormous energy, snigdhata, unctuousness in the body. Patients feel very full, energetic. The stress reduces and weight gains. The biggest, when patient, at what time patient notifies the cancer? He notifies the cancer not by tumor. He notices is that my weight is reducing. मेरा वजन कम होता जा रहा है, मैं पीछा पड़ रहा हूँ, मेरा पैंट्स लूज हो रहे हैं. These are the symptoms, initial symptoms, which compels the patient to seek some treatment. And by the grace of God and Sadguru, Kanchanar Grut Vardhaman Parayog immediately increases 2 to 3 kilograms of weight to this all patients who are approaching directly with us. There are two cancer patients. One is the skin cancer patient, and second, liver involved cancer. These two people do not respond well with Gruta. Usually, we are old generation Vaidyas, so we do not prefer to utilize Grutas in liver involvements, hepatic involvements. But personally speaking, I advocate that yes, Grutas can be used in liver preparations also. Acharyas have written Kamla and Pandu treatment with Grutas itself. So we should use Gruta. But because it is a tradition of old-fashioned Vaidyas, me and my guru, we do not prefer to use. So results are not that documented in melanoma, that is skin cancers, don't respond to this Gruta therapy. And second, contraindicated in liver problems. So these two, rest of all patients are very happy with maybe brain, maybe eye, maybe mouth, maybe neck, maybe lung, maybe abdomen or cervix or penis or rectum, colon, and number of cancers. But almost all cancers respond well, patients are happy with Kanchanar Gratam. It produces one kind of confidence that yes, however the result or the diagnosis may be, but now I have reached to a safe hand. This is an first month response of the most of the patients who are directly approaching us. This is a small group, say 15 to 20% of the patients. And then comes a huge group of patients who are interested or intend to take Ayurvedic medicine and modern conventional treatment like chemotherapy, radiotherapy, immunotherapy, and blah, 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 blah. Yes, only Kanchanar, nothing more. Kanchanar and Grut. Kanchanar, Patra, Pushpa, everything is fried in the Gogruta, and that is called Kanchanar Grut. So that way, the second group prefers to have Ayurveda and modern conventional treatment all together or side by side, add-on treatment. And this is a very big group, say 85%. And in this group, we have to take care of the patient's general condition and specific measures to be taken, along with our anti-cancer Ayurvedic protocol. Our anti-cancer Ayurvedic protocol comprises one, specific medicine for specific cancer, two, medicine for agni of the patient, four, medicines for the posture of the patient, five, medicines which are very popularly used everywhere, like Varun, Kanchanar, Ballatak, etc. Then a group of medicines prescribed for the digestion and elimination of the excreta. This comprises of, these are the protocols, or these are the upakramas that we explore in our each prescription. To say some of the, you see, Kasturi Bhairav for brain, Saptamrudlo for eye problem, Nasar Soharvati for nasal and lacrimal, nasolacrimal, cancers, Ardrak and Nityanand for mouth cancers, Aridra for tonsillary, PF fossa, and GB sulcus cancers, Tattur and for trachea bronchogenic carcinomas, Pipli and Hirak for lung cancers. We do not treat heart cancers and we do not come across heart cancers. For Hika, that is diaphragmatic cancers, we use elaichi, cardamom, and for G junction, esophagus, and stomach cancers, we use Sudsikhar, Krushna Bang Bhasma, and Shatavari Amal Ki Kwatha. Then we come across liver cancers. Liver cancer, of course, all other medicines, but we very specifically treat liver cancers with Bijapuraka, that is Bijora. You might be calling it Dabakai or Nartangai. Citrus medica, that is the Latin name. It's a big papaya size citrus fruit with Karela type skin. That the juice of it is taken in the empty stomach, and that gives good results in all liver cancers, liver involvements, mets of the liver, etc., etc. Then, if it is an splenic involvement, then we use Iksurak with what do you say, eggplant, Runtak, बैंगन, ये use करते हैं. Then we come to intestinal cancers and colon cancers. Here the purposes rule the whole picture. So different type of Bola Parpati, Panchamrut Parpati, and sometimes Swarna Parpati also. They are used for big colon cancer. We use this Sagantarati use along with Mahayogaraj Guglu and some Vatsakadi Kwat. These are some medicines we are using in colon cancer. In rectum, again, Ballatak and Triphala. They are combined and used for cervical cancers and female genital cancers, Vaikranta Yoga of Siddhyog Sangra, along with Shatavari Gruta, Karanjadi Gruta, and Patoladi Gruta. These are the three grutas used for male genital, that is cervical, vaginal, and uterine cancers. Then we come to bone cancers, Avaguglu and Shilajatu. They are specific medicines for bone cancers. When there is a cancer in blood, then Sarivadya and Manjashadi Kwat with Sonanavasan Malti. That is a fixed treatment for that area. For all cancer, general cancer, Trilokidambar Ras and Rajmukankaras are used. Of course, because we are old-fashioned Vaidyas, we do not write Rajamrugankaras. We write RM Ras or anti-cancer capsule, like that. But I am giving you the actual name of their treatments, because if you see our prescription, it will not match like this words, but These are the ingredients of those Antica capsule, Antica 4, Antica 5, and Anrus, and etc. Short and hidden names. Then we take care of the Agni of the patient. The Datvagni is higher side and Jatragni is on lower side because of overburden of nutrition. So the Jatragni is on Manda side and Datvagnis are on higher side. So while taking care of Jataragni, we take care as a Pittahar and Shita Dravyas. This requires to be utilized by soda bicarb, swajikakshar, amla pittantak, kamduda, mukta, प्रवाल, आमल की शतावरी क्वाथ, आमल की रसायन मीन्स बलाधान किया हुआ 7 pavanas of amal ki ras. These are the medicines to be utilized for Agni settlement of Jataragni level, Koshtha level. And when it is coming to the Jataragni, Datvagni level, it is always a Mandagni. Here we have to use Agni Tundi type medicine or Vishatinduk based medicine. Vishtinduk Vati, Navjivan Ras, Agni Tundi, Bhallatak, Chincha Bhallatak, and these are the medicines which are utilized for the Agni settlement of the Dhatus. And in that way, we take care of the Agni of the all patients. Cost also is to be taken care if it is Krura Koshtha, if patients are concurrently taking chemotherapy, most of the patients either get loose motions or get constipation. If they patients, and they are all very well managed by the Ayurvedic medicines, right from Takra Shunthi, Takra Bhaya to Triphala, Panchasakar, Swadishta Virechan, Markandika, and n number of. Sajja Snehan is also preferable in the cases of colon cancer with constipation. Sajja Snehan is the Avasthiki Chikitsa of Grahani prescribed by Charaka in the 15th chapter of Chikitsa, where 2 spoonfuls of ghee plus 1 spoonful of salt is consumed in the empty stomach, followed with 1 glass of hot water. And before lunch and dinner, the patient is advised to take 1 plate of salad sprinkled with lemon, salt, and black pepper. That consumed, and then he can consume his lunch and dinner. This gives us Sadhya Snehan treatment, and within couple of days, his coast becomes snigdha and elimination takes place very fast and very smoothly, and that helps us in all matters. That the coast is snigdha, then our medicines reach faster into the circulation and get faster results. So in that way, we also take care of the coast of the patient, Agni of the patient. And there are some popular used medicines like Kanchanar, Gugulu, Varunadi, Kwatha, then Ballatak. Yes, we use Ballatak in a form of powder. We take Ballatak in different forms. We initially powder it, we do not purify it. We शोधन नहीं करते, सीधा ही यूज करते हैं अशुद्ध फॉर्म में, क्योंकि शोधन करने से उसकी टॉक्सिसिटी या तो उसकी स्ट्रेंथ, तीक्ष्णता कम हो जाती. We need its तीक्ष्णता to be utilized. So we use Ballatak also, and Ballatak in the form of powder, and that is to be taken with milk. These are the different medicines that we are using in our protocol. There are some specific protocols also when there is an extensive skin involvement with means melanoma type involvements, where bleeding is a big problem. Along with the cancer presentation, bleeding is another problem. There we need to utilize point capsule, Ayu Pharma perhaps. That points capsule assuredly works very well and reduces the bleeding, checks the bleeding. Styptic effect is very fastly available. So in melanoma, we use this treatment. But when there is an internal hemorrhage, internal bleeding, hemoptysis, hematemesis, and intraocular bleeding, or say intestinal bleeding, excessive menstruation, bleeding rectum, and in this type of cases, along with point capsule, we very assuredly use goat milk and Vasasphoros. Edatoda Vasasphoros, 1 cup, and 1 cup of goat milk twice a day. This also is an assured treatment for all type of hemorrhages and bleedings in the body. May it be in the brain, in the eye, in the nose, mouth, throat. So please repeat capsule name. It is capsule point, P-O-I-N-T, point. Very much effective. Ayu Care Pharma or Ayu Pharma? I don't remember.
Ayu Pharma.
Ayu Labs.
Ayu
Lab. Maybe somewhere. Because I am concerned about the results, not the manufacturer. Because the purchase department is a different department of mine. And in that way, these are the different treatments and aushadas, medicines that we use to settle the patient. And second part, we need to duration and dose in point. Oh, it is depending upon the severity of the bleeding, maybe 1 TDS to 3 TDS. And as soon as the bleeding is checked, you can reduce the dose also. Vasasaras and goat milk are very good in blood problems, blood platelets, WBC, RBC, hemophilic type problem, factors, coagulopathies, they work very well. Durva also is a good candidate for coagulopathy problems in cancer patients. There are some specific Vardhaman Prayoga also we execute in some of the patients. Then there is a lung involvement, pleural involvement, effusion, and ascites type of problems. We reverse it with Vardhaman Pipli Prayog and Ajakshir. We keep patient Ajakshir on Ajakshir. 1.5 liters of minimum Ajakshir is consumed, and Vardhaman Pipali 10, 20, 30, 40, 50, 60, 70, 80, 90, 20, 100. Then on the next day, 90, 80, 70, 60, 50, 40, 30, 20, and 10. This Pipali is boiled in 500 ml of goat milk plus 500 water, 500 milli water. It is boiled, and when water evaporates, then it is taken down. When it cools little, then a blender is phosphorus 1 cup. It is churned with the blender to make a thick shake. Then cardamom and sharkara is added, and 250 ml milk in the morning with the medicine, and 250 ml evening in the medicine with the medicine, routine medicine. This is a specific Vardhaman Prayog used for lung, pleura, and ascites, peritoneum cancer. They are all metastatic cancer, but are very much annoying cases. And this Kshiravrutti with Vardhaman Pipali works very well. We should churn Pipali along with, yes, if we do not churn the Pipali, then the Pipali doesn't work in a routine infectious pneumonitis or pleural effusion affections. Then you can use only the milk. But when it is an malignant involvement of pleura or lung or peritoneum, there you need to make strong. The patient very difficultly tolerate this 60, 70, 80 Pipilis. But we have to forcefully or by hook and crook पेशेंट को समझा बुझा के देना पड़ता है, अदरवाइज द रिजल्ट्स आर स्कैर्स. वो 2, 4, 5, 10 पिपली का करके पिपली निकाल के वो दूध पिलाओ, वो नहीं चलता. हायर द डोज, बिगर द डोज, स्ट्रॉन्गर द डोज, faster the result. And we simply not only have to treat the patient, we have to fight and withstand with the chemotherapy also, which is deadly, poisonous. So in that way, it is very difficult to manage such type of, when we use 64 Prahari. Yes, this 64 Prahari Pipali also sometimes works better. But because we do not have that much good source of manufacturer over here of Chatushashti Prahari Pipali, we go for this grocery pipali fruit, and we boil it and crush them in the Shirapa, Pipali Shirapa. Now we have developed the Pipali Shirpak spray-dried powder also. That is more convenient. 1 spoon, 2 spoon, 3 spoon, 4 spoon, 5 to 10 spoon, then 9 spoon, 8 spoon, like that. It works very well. So we have in that way Rasona Shirpa powder also, and we have prepared perhaps Ashwagandha Shirpak also in a powder. But this Rason Shirpak and Pipli Shirpak powders, spray-dyed powders, are very abundantly used and very conveniently used. One of my students is working on Pipli Shirpak with lung affections. PhD कर रही है, आपके साउथ में, केरला में ये है कहीं पर। तो in that way we take this what you say, Pipali Vardhaman Prayog. Then we have a Vardhaman Prayog of Navajivan Ras also. When there is an CNS involvement, or when there is an depletion, severe depletion of Jivan in the patient, then Jivan is the karma of Rakta. When the Rakta is compromised, Rakta composition is compromised, low counts of the blood, platelet, white cells. Here we use Pipli Shirpak and Rason Shirpak also with Navjivan Ras. Navjivan, how we utilize Navjivan Ras, 5 BD, 10 BD, 15 BD, 20 BD, 25 BD, 20 BD, 15 BD, 10 BD, and 5 BD. Twice a day with Rason Shirpak. The same way as Pipli Shirpak, 50 to 100 gram of Rason is taken, crushed and mixed with 500 ml, 500 ml of goat milk and 500 ml of water, boiled. When it becomes a Kshirapak, Kshiravashesham Tandurutam, then it is crushed with blender, added sugar and sharkara and flavor, this cardamom, and consumed twice with Navjivan. This is another prayoga when in the cases of cancer, blood cancers and CNS involvements and severe dhatu agni depletion, which endangering the life. At that time, this Navjivan Vardhaman with Rason Shirpak is administered and with very good success. Those chemotherapy-induced leukopenia, chemotherapy-induced stomatitis, and lack of bodily. Can we please get recording? I don't understand what you asked.
You will get recording. Thank you,
Okay,
sir.
fine.
Continue, sir.
Oh,
Sir, you can take up the questions in the last, sir. Please continue,
yeah.
sir.
Okay.
I request
So,
Vaidya, write down your questions and post later. So we can, sir will not get disturbed. Thank you.
no, I am also happy with interaction, but
Okay, sir.
I couldn't
Fine.
understand. No problem. In this
Okay,
way, this Navajivan Ras Vardhaman with Rason Kshirpak, sometimes Rason Kshirpak alone is given in skin problems, means melanoma and severe psoriatic arthritic patients are also prescribed Navjivan Ras Vardhaman with Rason Kshirpak. And they, in psoriatic patients and arthritic patients and what do you say, skin, chronic stubborn skin problems, resistant skin problems, steroid dependent, they all respond very well with Rason Kshirpak. You can try in your personal patients also. So this was a specific dose. Yes, in some very heavy gallbladder cancer patients where the tumor blocked the CBD and the retrograde hyperbilirubinemia. Sometimes patient come with 21 bilirubin. Here we use Leave 52DS in Vardhaman Kram with 5 Nibu Suras and Trikatu without water. Neat पीना है और ये leave 52 days, 5 BD, 10 BD, 15 BD, 20 BD, 25 BD, 20 BD, 15 BD, 10 BD, 5 BD. This works quite well. And when there is no possibility of ERCP or this Leave 52 Vardhaman program also fails, then as a last resort, we use Indravaruni, Colocin, fruits. It's an fantastic prayog. I am not convinced how it works, but what we do, we take 10, 15 Indravaruni. Oh, somebody is making noise.
Dr. Sadanand Patil, if you can mute your mic, that would be
Yeah. In some patients, Leave 52 DS Anupan, it is 5 Nibu, lemon, swaras, and add 1 teaspoonful of trikatu, shunthi marich pipili, and don't add water. Consume neat with Leave 52 DS. Bit difficult, but that is the way. Acharyas have written, Brushesh Chamlai Katukoi Stikshne, Brushesh Chamlai Rupa Acharya. Charaka says in Kamala and Pandu Chikitsa. So we utilize in that way. But when there is no scope, then there is an funny program we conduct. We take Indravaruni fruits, put in a toker, bucket-like vessel, and the patient is instructed to walk on them and crush them by open, barefooted. He have to crush it. The more he crushes, the bilirubin levels get down. And within 15 minutes, his mouth taste is altered. वो मुंह कड़वा हो जाता है. इंद्रवरुणी is extremely bitter. तो वो मुंह कड़वा हो जाए, then immediately he is taken out from the bucket and his legs are washed completely. If we continue this even after bitter taste, then it bleeds in the vagina and rectum. वो पाइल्स को खींच के बाहर निकाल देता है और यूट्राइन ब्लीडिंग भी करता है. इसलिए the moment the patient says that my mouth is extremely kadwa, tikta, bitter, then he is pulled out and washed. But within couple of hours, the bilirubin reduces from 11 to 8 or 23 to 14 within couple of hours. Inspired by this, I tried Caravelle for hyperglycemia also. And that also surprisingly worked very well. Within 2 hours, the blood sugar level reduced to almost half. Caravelle पर चालो खुले barefooted और उसको क्रश करो तो hyperglycemia भी कम होता है. This is something very innovative or rather non-convincing, but results are there, so we can utilize them. So this also is a interesting observation, clinical experience rather I should say. In this gallbladder or hepatobiliary cancers, and when there are hepatic metastasis, huge hepatic metastasis, then there is a very nice funny treatment. If you do Caravella fruit, yes, करेला, वो मामोइडिगा, वो कुरपर संधि में रक्त मोक्षण करो तो इमीडिएटली हिपेटिक मेटास्टेसिस हैं एकदम श्रिंक हो जाते हैं, जस्ट इन ए वन प्रिक वो सब श्रिंक हो जाते हैं. ऑफ कोर्स 150 ml जैसा ब्लड निकलता है, बट ऑल मेटास्टेसिस श्रिंक. आधे घंटे के बाद सोनोग्राफी कराओ, दो सोनोलॉजिस्ट कंफ्यूज हो जाता है, अभी आधे घंटे पहले मैंने लिखा तो वो तो कुछ दिखते ही नहीं. बट फनी इज दैट विदिन अ वीक those metastases again reappear. लेकिन पेशेंट को खुश करना है, then this Kurpar Sandhi Rakta Mokshan is good, and perhaps repeated periodic Rakta Mokshan from the Kurpar Sandhi, Vama Dakshin Kurpar Sandhi, that's important, can reduce the hepatic metastasis in the lobes, different lobes of liver. I have also tried maggot in cancer patients. You might one surprise, but I was looking in a Discovery channel where in jungle, if deer or a hog is dead, then within 8 hours, it is completely decomposed and ate by the maggots. And there is nothing left there, not even bones. Then I inquired about this event, which are these, what I say, kida, maggots. Then I inquired in entomology, and one Israeli fellow gave me some clue that these are the what do they say? These are the maggots which are used for fishing purpose because they are very happy and they are very voracious. So I purchased some maggots and implanted them in huge, big, fungated breast cancer patients. And to my surprise, within 3 hours, they completely ate the whole breast cancer fungated tumor mass. And I was very pleased. But then they started eating the chest wall also. And at that time I was worried. ये तो अंदर उतर गया तो मुश्किल हो जाएगी. So very fast I had to remove all of them. But they had almost completely consumed the tumor. That was a plus point. Then I tied them with a string and then put them on the surface of the fungated breast mass. So they don't enter deep into the tissue or in the chest wall. In that way, I managed this bloody maggots. That also I have done. Then I also have done big tumors with copper wire tied tightly and then given mild shocks so that it cuts and heals. And necros, cutting, healing and necros at a time, necrosis. वो करते करते फिर हर रोज टाइट करते हैं, हर रोज शॉक देते हैं, हर रोज टाइट करते हैं, हर रोज शॉक देते हैं, करते करते वो ट्यूमर कट हो जाता है और फिर जात्यादि करंजादि पंचवल्कल से रोपण कर देता है। ऐसा भी मैंने किया है और आप सब भी कर सकते हैं इफ यू हैव दैट टाइप ऑफ facility, that type of permissions and that type of courage, rather, I must say. Pain, usually cancer is not painful, but it occupies the place where the nerves are passing or the tumor is pressing the nerve, then there is a pain. In these cases, Agni Karma gives me quite good results. I do Agni Karma with Swarna Shalaka and good results are in pain management, good results are there. Of course, the whole protocol also is behind it internally, orally, but on top of the body, Agni Karma also gives immediate pain relief, but temporary, immediate but temporary. It again recurs. But then repeated Agni Karma is. Second thing is Vidya Karma. Vidya Karma also is a mild kind of Agni Karma. And it gives वो पेरिफेरी पर ट्रैप हुए दोष होते हैं वो विद्य के द्वारा शरीर के बाहर निकल जाते हैं and that produces anesthesia and pain anodyne effect. Vidya is more convenient, more frequently used, and can be used at any place. Doesn't require fire or heating, and results are not a Agni Karma, but still good. I use this stillet, intrathecal anesthesia की वो जो लंबा स्टिलेट वाली होती ना सिरिंज, उसको मैं बोन के मेटास्टेसिस में अग्निकर्म करने के लिए उसको उसके अंदर की जो स्टिलेट होते है उसको रेड हॉट करके अंदर घुसेड़ता हूँ तो बिल्कुल बोन पर जाके वो लगती है अगर बगैर को डिस्टर्ब किए बगैर. That gives me good pain relief in bone metastasis. This also I have done, worked, and I teach to my students and encourage them also. And this is all because of the blessings and permission of my Sadguru Mahanandanand. He always says, करो ना, सब ठीक हो जाएगा, मैं हूं. ये कौन बोलता है इस जमाने में? मैं हूं ना, चिंता मत करो, कुछ नहीं होगा. होता है, कई बार गड़बड़ होती है, लेकिन फिर वो हैंडल भी करा देती है हमसे ही हमसे. तो in that way, if somebody is on your head with a blessing hand, then everything is comfortable for us. And I have utilized Reiki, I have utilized acupuncture, acupressure, this Shastra Karmas of Shushruta. Oh, one Shastra Karma I use in Indrabasti with the, and Indrabasti Marma surgery also. It's a mild surgery, local surgery in calf muscle. If you treat here, apache, or non-responding neck tumors, they respond well. That also I have tried on 3-4 patients with MRI of calf. Durga has written that in calf muscle there are mastanda nibhani jalani. So the same thing was seen in MRI of the calf muscle, but my counterpart, oncosurgeon friend, told this is an artifact. There is no such type of structure in this area. I said, by the sake of सुश्रुत just एक स्लीट करना, अपन देखते हैं, अगर नहीं होगा तो we'll close it. And as soon as he incised, he was shocked to see, oh God, oh my God, oh my God. I said, what happened? What is this? This is not the structure available in anatomy. This is pathology. You just remove them and I cauterize. At that time, we were using gallon of cautery. तो उसने वो सब एक्सरसाइज कर लिया और I did the gallon of cautery. And to our surprise, within 3 months, all these tumors and glands vanished. So Sushruta still remains relevant at the time of 2026. These are the wonderful, I must say, facts that we should share. और अगर 2048 में विकसित भारत को बनाना है तो we will have to be वो वोकल फॉर लोकल. आयुर्वेदा को इस तरह से थोड़ा एडवेंचरस बना के काम करना पड़ेगा. What this plop plop popping? I don't understand. Oh, it's our Valentine like that. Great. Thank you very much. So in this way, cancer has a vast possibilities to venture and work upon. If you want to, if the time permits, then only diet portion is remaining. Should I explore that?
Yes, sir. Yes, sir.
Please go ahead, sir.
It
Please,
is 10:15 already.
sir,
Okay.
if you are okay with that, please continue, sir. If you are okay with time, sir. We are here, sir.
Okay. You see, in generally cancer patients, in our institute we prescribe cow ghee, goat milk, and till tail, sprouts, vegetable juice and soups, fruit juices, and dry fruits to be consumed more. उगे हुए कठोर, हरी सब्जियां, सूखा मेवा, फलों के रस ज्यादा लेना है. तीखा, तला हुआ, वासी, गैस फॉर्मिंग वो सब बंद कर. इफ यू आर हंग्री फॉर नॉर्थ, so this is the diet regime for all generally cancer patients. Every cancer patient is given Mahamrutyunjay Stotra to be chanted thrice by whole family. This is one kind of OPD Deva Pashray Chikitsa. Yes, then, sir, Viruddhahar is not good for. Well, I don't have much experience about Viruddhahar. It may be problematic, but I don't have observed any come across Viruddhahar. Sir, Virudh, Virudh sprouts ना, वो भी चाहिए, वो भी हम तो करते हैं. शास्त्र ने मना किया है लेकिन हम करते हैं. और वो कहते हैं ना, शूल को शूल से निकलता. शठ प्रति शाठ्यम, tit for tat. So for cancer, use all stupidities you come across, no problem. और पता नहीं अब वो क्यों विरुद्धान का मना किया है, उस पर को भी चर्चा करेंगे उस सोच के. अभी तो फिलहाल कैंसर ठीक करने में पड़ा हूं, तो ऐसा सोचने का टाइम नहीं मिला. If it is an liver patients, liver cancer patients, or liver metastatic patients, then घी तेल चिकनाई बंद करना है. चना, चावल और मूंग की भुनी उबली चीजें खानी है. सभी खट्टे फल अच्छे होते हैं वो लेना है, दूध दही और छाछ बकरी के लेना है, जो भी रसोई बने उसमें दालचीनी लौंग इलायची काली मिर्च हींग मेथी लहसुन प्याज ये लिबरली डालना है. If the patient is not cholesterolic, then द्राक्ष अंगूर अंजीर वो सब स्वीटनेस बनाने के लिए डालना है. If this liver patients are associated with kamala, then उनके कपड़े उनके बर्तन उनकी बेडशीट उनका पिलो कवर सब अलग रखना है, अलग सफाई करना है, उसको कंप्लीट बेड रेस्ट करना है, खाना पीना सब बेड में खाना है. बूढ़े अशक्त और बच्चे उन लोगों का कांटेक्ट या संपर्क अवॉइड करना है. These are the instructions, dietary instructions for the hepatic problems. When there is an blood cancer, the routine cancer diet is prescribed. In addition, 4 छुहारा ड्राई डेट्स रात को पानी में भिगोना है, सुबह उसको चबा जाना है और उसके जो पानी बचा है उस पानी में उस पेशेंट की रोटी का आटा गूंदना है और वो रोटी खाना है. लिवर के गॉल ब्लैडर लिवर विद गॉल ब्लैडर वही तो बोला, उसमें ये सब करना है. फिर ड्यू टू ब्लैडर कैंसर ड्यूरिंग समझ में नहीं आया मुझे. फिर if it is a renal involvement or ureteric involvement, adrenal involvement, bladder or urethral involvement, then the diet should be दूध नमक amla is not contagious ना सर, वो मुझे नहीं मालूम, मैं ये करता हूँ वो आपको बता दिया. आपकी अगर इस बारे में ज्यादा पता नॉलेज हो तो जरूर शेयर करिए. we will be very happy to and thankful to you. But at present what I am doing, I am depicting. And in urinary nephrological problem, suggestion to men, pardon, to maintain whatever.
Manage the side effects of chemo in the treatment of breast cancer.
Yeah. That comes the next. अरे हाँ, मुझे वो तीसरे ग्रुप को भी बताना था ना. Yeah, the first group is directly comes to us. The second very big group, 85% who are interested in concurrent Ayurveda and allopathic treatment. And third 15% group patients come with terribly harassed by the chemotherapy, radiotherapy, immunotherapy treatments. And they have severe cachexia and leukopenia, hair loss, mucositis, weakness, darkening of the skin, hand, nails, everything becomes negro-like हो जाता है बच्चा बेटा. उसको हम एक स्पेसिफिक पंचकर्म कराते हैं. सुबह अभ्यंग एंड मात्रा बस्ती, दोपहर में शिरोधारा और शाम को अगेन मात्रा बस्ती. और प्रायर टू कीमोथेरेपी 3 days ये करते हैं, फिर कीमोथेरेपी लेते हैं, उसके बाद वापस यही चीज दोहराते हैं, अभ्यंग मात्रा बस्ती एंड शिरोधारा. दिस कीप्स द पेशेंट क्वाइट कंफर्टेबल. ल्यूकोपीनिया कम होता है, म्यूकोसाइटिस तो बिल्कुल, आई मीन स्टोमासाइटिस तो ऑलमोस्ट नहीं होता, मोस्ट ऑफ द पेशेंट्स में नहीं होता है. फिर रेडियोलॉजिकल, जो माउथ कैंसर की रेडियोलॉजी लेते हैं, उनको इमली का बूटा अंदर रखने को बोलते हैं, जिससे पैरोटिड डक्ट्स इंटैक्ट रहती हैं, उनको ज्यादा तकलीफ नहीं होता। व्हाट डू यूज फॉर मात्रा बस्ती? यार ऐसा मत पूछो, मात्रा बस्ती कर्म है, कर्मम नान्यद अपेक्षति। और अगर वेजाइना में या रेक्टम में रेडियोथेरेपी देना है तो एरन स्नेक का पिचू रखते हैं रेक्टम में एंड वेजाइना में, तो उसकी गर्मी कम लगती है और उसके कारण वो जो रेक्टो वेजाइनल या सिस्टो वेजाइनल फिसुला होती है उसके चांसेस कम रहते हैं। ये दीज आर सम। फिर हेयर लॉस के लिए एक लड्डू खिलाते हैं, 100 ग्राम बादाम, 100 ग्राम सिंगदाना, 100 ग्राम खरबूजे के बीज, 100 ग्राम सूरजमुखी के बीज और 100 ग्राम कोपरे का छील, डेसिकेटेड कोकोनट। ये सभी को हल्का सा रोस्ट करके ठंडे हो जाए तो उसको पाउडर कर लेना है और घी और गुड़ का पाया बना के उसमें उसको डाल के छोटे छोटे लड्डू बना देने। वो हर रोज एक लड्डू नाश्ते में लेते हैं तो ये केमोथेरेपी इंड्यूस्ड हेयर लॉस रिकवर हो जाता है। मेरे जैसा का उजड़े चमन का कुछ नहीं होता। तो इस तरह से हम, तो प्लीज सजेस्ट फूड हैक्स। आई डोंट अंडरस्टैंड हैक्स, व्हाट दैट? ये जैनजी के हम कुछ वर्ड्स ऐसे हैं ना कि नहीं पकड़ में आते। ओके, सो इन दिस वे different diet regimes can be utilized in different cases. And in bone metastasis, akhrot is utilized along with different diets. Akhrot is encouraged for the patients to consume more. Suka meva, dry fruits for brain involved diet for bladder related cancer. I started, but somebody interrupted it. If there is an renal azotemia and bladder cancer and this, then you have to use takra and ilaichi in profuse manner. उसको बंद करने में नमक, वो फ्रूट्स, ड्राई फ्रूट्स, धनिया, हरा धनिया, साबुत धनिया, वो सब बंद करते हैं। गरम गरम मान निकाला हुआ चावल, चावल घी और शक्कर, चावल और शक्कर, चावल की खीर, लौकी की खीर, गाजर की खीर, ये सब कंज्यूम कर सकता है इफ ही इज नॉट डायबिटिक। और दूध, दही और छाछ बकरी के लेने हैं। रसोई में ये सब जो मैंने लीवर में बोले थे वो सब डालना है। काली मिर्च, लौंग, इलायची, दालचीनी, हींग, मेथी, लहसुन, प्याज सब अच्छी तरह से डालना है और वो रसोई बना के खाना है, लेकिन नमक नहीं डालना है। अगर पेशेंट अफोर्ड कर सकता है तो 8 लीटर पानी उबाल के 2 लीटर कर ले और वो कंज्यूम करे तो वो 3 लीटर तक पी सकता है। वेयर जहां एक ही बोतल अलाउड होती है वहां वो 3 बोतल कंज्यूम कर सकता है। इफ इट इज, दिस इज आरोग्य अंबु प्रिस्क्राइब्ड बाय भाव प्रकाश। इट डज, वो CRF और किडनी के कैंसर्स में तो यूटिलाइज होता ही है, साथ में वो श्वास, कास, शोध सबको ठीक करता है। तो हमारे लिए तो वो मल्टीफैक्टोरियल वाटर इनटेक हो गया। लेकिन 8 लीटर को 2 लीटर करना वो 2 घंटे का काम होता है और वो एक्स्ट्रा लोड पड़ती है बीवी या माँ पर। वो अगर कंफर्टेबल है तो करना उचित है। वो इसके कैंसर में इस तरह से चलता है। स्टमक जी जंक्शन, उसके कैंसर में तीखा तला हुआ, वासी, वायु करने वाला, गरम मसाले, लहसुन, प्याज, रात को जागना, गुस्सा, इतने को बंद करा दे। और बाकी जंक फूड, बाहर का फूड, डिलीवर्ड फूड, गीक फूड्स, दे आर नेवर गुड फॉर एनी हेल्थी पर्सन। तो वो तो है। कुल देवी के दर्शन, विष्णु सहस्त्र नाम का श्रवण, कुल देवी के दर्शन, सदगुरु का अखंड स्मरण, सदगुरु का सानिध्य, सेवा, ये सब करना, वो दैव उपाश्रय चिकित्सा बहुत ही इम्पोर्टेंट है। और काउंसलिंग अगर हो सके तो सत्वावजय चिकित्सा भी करके पेशेंट को कूल डाउन, उसके स्ट्रेस को कम करना चाहिए। शिरोधारा इज एन इंड्यूस्ड मेडिटेशन, therapeutic meditation, so shirodhara should be encouraged. These are some my clinical experiences I have shared with you. I think you will have enjoyed it, or I don't know whether you appreciate or you gain something from it or not. But this has been the practice I have been doing since decades together, say 90s, in my 90s, 1990s. And this is the fourth generation. Please repeat. Laddu for hair fall. Yes. 100 ग्राम बादाम, 100 ग्राम सिंगदाना, 100 ग्राम खरबूजे की बीज, 100 ग्राम सूरजमुखी के बीज और 100 ग्राम डेसिकेटेड कोकोनट, ये सब का पाउडर करना है और घी गुड़ में मिला के छोटे लड्डू बना के हर रोज एक नाश्ता में खाना है। सर, यू हैव शेयर्ड वैल्यूएबल। ओह, थैंक यू वेरी मच।
Sir,
If
is
you
it
are,
to take a few questions, sir?
ओ बाबा,
It's 10:30. Only if you permit.
नहीं यार, बहुत हो गया।
Okay, sir.
गुड बाय, गुड
Sir,
नाइट, थैंक यू।
2 minutes, sir.
2 मिनट सर। और हमारा एक रिक्वेस्ट था सर, तो मतलब आप आगे भी आप आके यहाँ पे थोड़ा आप आपका टाइम दे पाएंगे हमको गाइड करने के लिए, तो बहुत मेहरबानी होगा सर। तो रिक्वेस्ट
अरे भाई,
आज नहीं सर, आज बहुत हो गया। 3 साल का तपस्या आज आए सर आप। मैं 3 साल से आपको फॉलो कर रही थी। थैंक यू
चलो,
सो मच।
हाँ, कभी मौका मिला तो फिर।
कोटी सर भी है, कोट ऑफ थैंक्स प्लीज।
ओके ओके ओके, प्लीज।
I would request Vishwanath Dixit sir to give vote of thanks. कोटी सर तो बहुत खुश होंगे नवजीवन रस सुन के, क्योंकि अपनी क्लास में बता रहे थे सर।
Namaste all. Namaste sir. Thank you all Vaidyas, and our humble pranams to you sir for giving your precious time and moreover sharing your voluminous practical clinical experience. I feel being very nascent in this field, and it requires a lot of time for us to reflect and assimilate. That is my personal opinion. Of course, experienced Vaidyas much more than us, they can grasp it better, I feel. Once again sir, heartfelt thanks to you. Thank you sir. Thank you so much. I would like to end the session with a small prayer. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramayah, Sarve Bhadrani Pashyantu, Ma Kaschid Dukkha Bhag Bhavet. Om Shanti Shanti Shanti. Thank you sir.
सर थैंक यू और प्रणाम सर। बहुत बहुत मतलब ऐसा ज्ञान भंडार के नीचे बैठ के बहुत अच्छा लगा सर। और गुरु माँ को हम लोग सबसे तरफ से प्रणाम बोल लीजिए सर। हमारा सौभाग्य माँ को मिलने का हो गया। थैंक यू सो मच सर। सर हम लोग साथ में एक फोटो लेते हैं, प्लीज आप आपका वीडियो ले लीजिए, ऑन करिए सर के साथ एक सबका फोटो, दोज हु कैन टेक स्क्रीनशॉट। सर आप आपका वीडियो ओपन करिए सर, 2 मिनट सर। थैंक यू सर। प्लीज प्लीज अंदर निम्न वीडियो ऑन ಮಾಡ್ಕೊಳ್ಳಿ सर इज आल्सो केम सुरेंद्र शर्मा सर। Sir, Surendra Sharma sir is there, sir. Koti sir. Thank you, sir. We are blessed. Please, tagondra photo. Have taken? Rajalakshmi madam. Okay, madam. Have taken, ma'am?
ತಗೊಂಡಿದ್ದೀನಿ ಮೇಡಮ್ ಒಂದು ಇಲ್ಲಿ.
Screenshot tagoli, sir. I will take from here.
ಶರ್ಮಾ ಸರ್ ಸರ್ ಮ್ಯೂಟ್ ಆಗಿದೆ ಅಂತೇನೋ ಸರ್ ಏನೋ ಹೇಳ್ತಿದ್ರು.
Thank you so much, sir. Yeah, Koti sir.
Hello.
Yes, Surendra Sharma sir. Yes, sir ji.
हेलो। नमस्कार।
नमस्कार जी, नमस्कार।
नमस्ते। कैसे हैं आप?
बढ़िया है सर, आप लोग का आशीर्वाद है सभी का।
सब नागार्जुन के आशीर्वाद।
इंद्रवारुणी बहुत अच्छा कल्प है सर।
बिल्कुल, हाँ सही बात है, लेकिन उसमें ख्याल न रखे ना तो वो यूट्राइन ब्लीडिंग या तो पाइल्स का ब्लीडिंग शुरू हो जाता है।
बिल्कुल,
वो जरा ध्यान रखना पड़ता है, अदरवाइज इंद्रवारुणी से
वैसे जैसलमेर में संधिवात में भी इसको कुचलते हैं।
हाँ हाँ हाँ,
संधिवात में कुचलते हैं इसको।
शायद सुश्रुत ने लिखा है द्वेपाद मध्य पुथ सन्निवेशे उष्णाति देहम, ऐसा कुछ है, तो शायद वो नाड़ियां कुछ काम करती होगी और ये सब।
और इंद्रवाणी मूल का कंपवात में बहुत अच्छा रोल है सर।
हाँ जी, हाँ हाँ हाँ, हमारे यहाँ उसका यूज होता है, लेकिन फिर वो
मैं बहुत यूज करता हूँ उसको कंपवात में।
अरे वाह,
बहुत अच्छे रिजल्ट है उसके। और उसकी मूल का संधिवात में बहुत अच्छा रोल है।
देख सकते हैं, मेरा कोई उसका अनुभव नहीं है, मैं देखूंगा।
संधिवात में पिपली, इंद्रवाणी मूल और गुड़ मिला के गोली बना के लेते हैं। ये शास्त्रीय योग है, वैद्य चिंतामणि का योग है ये।
अरे वाह, बढ़िया,
वंडरफुल योग है बहुत।
ट्राई करूंगा मैं जरूर। आप कहाँ पर हैं सर?
मैं हैदराबाद में। कोटी जी हमारे ही है।
ओह क्या बात,
सर का स्टूडेंट है सर।
हाँ हाँ, वाह
सर मैं आपको उस दिन सर के बारे में बोल रही थी ना सर।
बराबर, हाँ, वी हैड ए वेरी टॉकेटिव इंट्रोडक्शन अबाउट यू सर।
थैंक यू और मैं 64 पढ़े पीपल को बहुत ज्यादा पसंद करता हूँ सर।
पसंद करते हैं, हाँ, पिपली वंडरफुल ड्रग है। आपके यहाँ हैदराबाद
मैं खुद बनाता हूँ वो बहुत वंडरफुल एक्शन है उसका।
अरे भाई, हैदराबाद के हमारे एक दोस्त हैं, वो अजा यकृत में पिपली ठूस के उसकी मसी बनाते हैं।
यस यस,
हाँ, ब्रेन पिपली, यकृत पिपली, पिपली, हाँ, वो सब भी करते हैं। हाँ
बिल्कुल,
पिपली गजब की रसायन और योगवाही
भी है, और उसका एक बहुत अच्छा फंक्शन है कि ये सेल के माउथ को ओपन करता है।
एग्जैक्टली, यस।
कोई दवा अगर माउथ को ओपन नहीं करे तो 64 पॉइंट पिपली उसको ओपन करती है, इसलिए योगवाही सब में मिला के देना है इसको।
सही बात है
जी।
अरे भाई, मेरे को वारी शोषण चाहिए। हाँ
मिल जाएगा,
कल ही भेजो।
ओके सर जी। शर्मा सर से ही पहली बार मैं अष्ट संस्कारित भारत बनाने के लिए सर ही मोटिवेशन है सर जी।
वाह 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 भाई, बहुत। देखो, आप अगर शिष्य बने रहो ना तो गुरु तो आपको मिल ही जाते हैं। इम्पोर्टेंट
अष्ट संस्कारित भारत भी मैं मेरे पिताजी से ही साथ किया हूँ सर।
हाँ, मेरे गुरु ने भी मुझे अष्ट संस्कारित सिखाए, अपने हाथों से कराया सब कुछ। हाँ, मेरे सदगुरु माँ अनंतानंद के यहाँ 1200 किलो पारद का शिवलिंग है।
हाँ जी, हाँ जी,
पूरा बड़ा शिवालय है।
बताया,
कभी पधारो। हाँ, कभी
जरूर
पधारो।
जरूर जरूर जरूर,
बहुत अद्भुत दर्शन है। बहुत
बिल्कुल
अद्भुत दर्शन है। हाँ
जरूर
और
आऊंगा सर।
जरूर
सर,
जरूर।
हमारा सौभाग्य था, लास्ट टाइम हम लोग गए थे तो सर ने हम लोगों को पारद लिंग का दर्शन करवाए सर। तो रुद्र पारायण भी चल रहा था, तो बहुत अच्छा
बरोबर।
प्रसाद भी मिला, सब सर की कृपा से। और थैंक यू कोटि नागार्जुन सर, सर बताए कोटि बोले थे मैं कि ऐसा कर, तो थैंक यू कोटि सर फॉर दैट एक्चुअली।
ओके ओके मैडम। सर जी प्रणाम।
Let us conclude. Let us
राइट
conclude
सर,
now.
नमस्कार सर, नमस्कार
नमस्ते, प्रणाम
नमस्कार।
प्रणाम। जय
प्रणाम
हो,
सर,
जय हो।
जय आयुर्वेद सर। थैंक यू कोटि सर, सुपर था। 1 मिनट भी यहाँ से वहां पे हिलने का मन ही नहीं कर रहा था सर, बहुत ही अच्छा था। अच्छा मतलब अच्छा का वर्ड ऐसा नहीं है, इट्स मतलब देयर इज नो वर्ड्स अबाउट इट। सर के साथ हम लोग 2 दिन जैसा बिताए, नहीं लग रहा था कि हम लोगों को थकान ऐसा। एक्चुअली हम लोग कभी कभी थक जाते थे, सर कुछ नहीं थकते थे सर, वो बहुत यहाँ पे बैठ, सर है ना, सर है आप अब सर ऐसा ना बोल के यहाँ पे बैठते थे, हमको थकान आता था, सर को कुछ थकान नहीं, ऐसा ही स्माइलिंग फेस, ऐसा ही अरे चुप, ऐसा इतना प्यार भरा सर, बहुत अच्छा लगा सर। सर आपके साथ और एक बार जाएंगे सर, सर के यहाँ पे।
ऑलवेज वेलकम।
हाँ सर, सब मिलके जाएंगे सर, मुझे तो ये अभी भी मन नहीं भरा है, और 2 दिन उनके डांट सुनना है, मैं तो बहुत डांट सुनती सही सर, बहुत अच्छा लगा, इतना मतलब।
सर शर्मा सर, मैं भी आती हूँ उस समय।
बिल्कुल
राजलक्ष्मी।
बिल्कुल, यस पता है, देख लिया हूँ आपको।